you come up here, please? George? Could somebody get the people out of the room next door for me, please? Let's get started.
Oh my goodness. Thank you.
I want to bring everybody in.
Oh, yeah. Oh, how nice. Hey, thank you. Oh, I tell you, this is rewarding to be here to see all of these good people, you know, and having all the.
I wonder how many people your book saves.
Well, yeah, we're only beginning. That's the bad part. Pardon? No kidding. It's too this year. Too bad. I don't know. I guess I can't get over that. Yeah, I was just going to leave you a chance to talk.
In an effort to get the show on the road, the American Academy of Biological Dentistry has an award for Dr. Meining. The American Academy presents this diploma of recognition to George E. Meining for his leadership in the health crusade to help others throughout a lifetime of dedicated effort. Given today in Carmel, California, March the 5th, 1999.
Thank you. You're all wonderful people, and I can't tell you how thrilled I am to be here. Maybe get on the chair.
Where are you up here?
But you can introduce me.
I will.
Whatever you know about me. It's not much. It's anyway my husband.
I'm just happy you're here. I'm very interested because I do this kind of work.
Yeah.
Our next guest speaker is Mrs. Issels. Her husband passed away. It was 2 years ago, I believe. Wasn't
1 year ago.
1 year ago. Of all the lectures, this is probably one of the most important ones you're going to hear over the weekend. So please pay attention, Mrs. Issels. And she's going to be discussing the focal infections, theory, root canals, and cancer. And with that, why don't you start? Here's your laser pointer here.
Thank you.
Okay. More slides.
Thank you very much. Thank you very much. I have already a dry mouth to start. It was so much easier for me to sit in the audience and hear my husband speak and criticize him than being here myself. I would like to thank Ed and Carol and the ladies and gentlemen of the board of the Academy for inviting me. And I would like to thank you all, ladies and gentlemen, for your interest in Dr. Issels' comprehensive treatment of cancer, of which biological dentistry was a very important pillar. And that's the reason why I'm here today. It is my pleasure to share with you my experience with his work as his wife and closest collaborator for 40 years. I know he would have loved to be here himself today, because I know how happy he was when he met you 2 years ago. He always enjoyed to exchange experience and to learn. And you showed him with your work and your results that his work and his perseverance were not in vain. As you probably all know, he is considered or remembered worldwide as the pioneer for a true integrative cancer medicine based on the holistic concept. A concept which attends to both the cancer tumor and the tumor host, the body as a whole, body and mind. I mean the person as a whole, body and mind. This means correcting causes and preconditions which have led to the formation of the tumor in the first place, and which can, if not corrected, lead to recurrence. We all know that conventional medicine has made great strides in eradicating cancer cells, but there are still too many cancer patients dying who need not die. We need not wait for the magic bullet, which will probably never exist because cancer is a multi-causal problem. But what we do need is a close, well-coordinated cooperation of all specialized fields. And I would like to show you now a few examples which stand for many of cancer patients which were by conventional standards considered incurable, but yet achieved complete long-term remissions and remained cancer-free for many decades, up to 4 decades. And let me show you now. This is him. This is Joseph Issels, as many of you have known him. The dedicated doctor who never gave up and who did not accept the diagnosis incurable. In fact, he did not accept anything that he did not think was right. Maybe in order to help you understand him better, I briefly tell you an example of what was so typical for Joseph Issels. At the age of 29, he had just finished his education as a surgeon with Europe's leading abdominal surgeon of that time, Orator. Before settling down, he was sailed as a ship's doctor around Africa and saved a woman's life by performing a complicated abdominal surgery against the order of the shipping company, thereby risking his career. He had asked the captain to return to the harbor because he diagnosed a perforated stomach and knew this patient had to be operated immediately, otherwise she would die for sure. The captain cabled the company, said no, it's too costly. So Dr. Issels said, I take it, it's my responsibility. She has 3 children and she has a little chance of survival, but let me take this chance. And he did save her life. When he left, when he had sailed around Africa, I mean, when he had finished this trip, she was discharged of the hospital and was at home, happy with her children. And in 1938, he even risked his life when he got the order from the Nazi party to not treat his Jewish patients any longer. He was so outraged that he resigned from the Nazi party for political and ideological reasons, and he was first doctor to be drafted into the front lines. I mean, at that time it was even worse than never having been in it. It was a great risk. And he marched to Moscow and back. Took him 4 years, was Russian prisoner of war, but he survived. And in 1951, when he had a ward of 35 beds in his community hometown hospital, just 35 cancer patients on one floor, he realized that he needed to have a special hospital, a special facility to be able to help these patients who were terminal. So he decided to open a place in 1951. The president of the local chapter of the medical association warned him. He said, you will ruin your career, ruin your life and that of your family, but Issels couldn't do otherwise. And he paved the way he prevailed and paved the way for German doctors being able to carry out alternative treatment without being harassed, and all insurance companies paid for this or pay for this treatment. And this hospital, which he founded in '51 as the first one of this kind in Europe, was enlarged in 1970 from 80 beds to 120 beds, 195 staff, extensive research facilities, research on tumor vaccines. We had mice. So, and we had a big, big dental department, because he found out in the early 50s that it was very important to remove focal infection, root canal teeth, and tonsils. And he didn't want to impose additional costs to his patients. And therefore, he had this dental department with laboratory and everything in order to be able to give them the real care they needed. Now, let's not, the biased wife, talk about him. Let's his work speak for itself and for him. And I would like to add that although he had many opponents from '81 to '87, the German federal government asked him to be a member of the government commission in the fight against cancer. Now I would like to show you a few examples. This was a Hodgkin which had resisted conventional treatment. In this condition, she came to our hospital. This was 4 months after treatment. Still some tumor left, as you see, because Dr. Issels always tried to achieve the tumor remission slowly in order not to overburden the body, which is already toxified, not to overburden it with the tumor, with the products of tumor lysis, which are very toxic. And that's why many patients in the very good and famous cancer centers die, because conventional doctors don't think highly about detoxification. And the patients, the tumors shrink, but the patients cannot get rid of the toxins. And this was 6.9 years later. And this is a girl of 2 years. She had a rhabdomyosarcoma, a very aggressive tumor, which had already destroyed the jawbone. She was referred from Great Ormond Street Hospital, Dr. Nunes, who treated the children of the Queen in London. They couldn't operate her anymore. And she didn't respond to chemotherapy and radiotherapy. And in this condition, she was admitted to our hospital. The jawbone destroyed. During treatment, the tumor could be rendered operable. The tumor shrank and was movable. And Dr. Issels referred her back to her surgeon. This is one example of interdisciplinary cooperation. I had the tumor removed, because as much tumor as can be removed by surgery, the better, because it helps the body to get rid of the toxins. It's always difficult for a body to shrink big tumor masses, but it happens sometimes, and the patients are still well. I will show you some examples. And this is the girl 20 years later. She just needs a better graft. And these are, on the left side, metastasis, you see in the lungs, of a seminoma, a testicle cancer. You see this lung, and this was 2 months after treatment. Here is a spindle cell sarcoma. The patient was a young man, didn't respond to chemo nor to radiation, was admitted in this condition to our hospital. And this is him 4 years later. And this is 26 years later. He will come and visit me this summer with his wife. He married one of our best secretaries. We lost so much staff to our patients, fortunately in a way. And this was a Hodgkin, lymphogranulomatosis. And you see the patient 5 years later, only immunotherapy. She got married and is very happy. I got news recently. And this was in 73. This was a patient in 56, thyroid cancer. She had a biopsy here. refused radiation, surgery and radiation, came to our hospital, and this was 3 months later. We followed her about 15 years. It was an elderly lady. And this was a lymphosarcoma. The primary was on the neck, and she had an enlargement of the mediastinum. This was 14 years later, and this is, I don't know how many years later, and she is still in good condition. This was a spindle cell sarcoma, which had grown around the spine. It was in 1952. We had only immunotherapy available at that time. She had resisted to radiation. She had first a surgery and then radiation. And this was her 24 years later, only immunotherapy. She came twice to the hospital. I'll explain to you later when you see the fever charts. Patients mostly stayed 2, 3, sometimes even 4 months. And then they had the treatment continued at home under according to the instructions of Dr. Issels, under the care of the home doctor. And here you see her with her children. This was 28 years later. This was a teratoma. You see the size marked on the abdomen of this young boy. And with only immunotherapy after 11 months after start of treatment. And this is the young man several years later, seven years later. And this was an osteosarcoma of a young girl. She was only 12. Here you see the lesions in her bone, and the doctors wanted to amputate the leg from the hip down. Amputate. The parents wanted to try something else first before to make this decision. And this was a girl, I mean, she is, I don't know how many months later. How much?
About 3.5.
3.5. And she's still alive. She won a skiing competition 2 years later. And she's married, has 2 children, is very happy, lives in Australia. We had 1 doctor in the archives and 3 secretaries who were just following up patients. And this was after mastectomy. The patient had metastasis in the scar and an inflammatory recurrence, which is resistant to all conventional treatment. She got immunotherapy, and this was 3 years later. I know we followed her about 15 years. She was an old lady already at that time. And this was an interesting case, a tumor of the nipple of a young woman, 24 years old, who recurred 7 times. This was the 8th relapse, and this time it was already cancer. It was a Paget. And as the other breast had already a cessation, the doctors wanted to amputate both breasts. And the parents wanted to try something else, understandably. And this is a young woman, 22 years later. She married a count and lives in Paris. So not bad. He might not have married her without both breasts. And this is also an interesting case which we sometimes show to our patients in order to encourage them not to give up when a tumor seems to continue to grow during treatment. And sometimes even during treatment it might not be an actual growth, it's just more sort of an inflammation, peritumoral inflammation. I show you now, this was a breast cancer after lumpectomy. You see, lumpectomy here. And this is during treatment. You see, it looked like getting worse. Doctors got nervous, patient got nervous, understandably. And this was, can you read how many months later? Or how many weeks into the treatment? You cannot. Then I have to go there. I cannot read it. It was during treatment. Treatment mostly takes 3 to 4 months, and if in complicated cases, even 5 months. And this was one of the biggest tumors, a teratoma. It was a recurrence. The primary tumor was removed by surgery and had chemotherapy. And with this recurrence, the patient came to our hospital. He got, this was even already 8 weeks into the treatment. And as the tumor was growing very quickly, my husband gave him, Dr. Issels gave him 2 shots of chemotherapy, cyclophosphamide, which helped achieve a stop. You see, sometimes with very quickly and aggressively growing tumors, Dr. Issels used chemotherapy to get a stop of the tumor growth in order to gain time for immunotherapy, which is a long-term treatment, to work and patient to respond. This was 7 years later. He is still fine. He lives in Austria and does a lot of skiing. And here you see the tumor had grown into the lung. And this you see after treatment. And now it's another interesting case. This girl had a rhabdomyosarcoma of the liver, a primary sarcoma of the liver, which is very aggressive. No surgeon in Europe tried to operate on her, and we found a specialist in Colorado, in Denver, who took away 4/5 of the liver, and in the remaining 5 there were spots which were suspicious of liver metastasis. And she got chemotherapy, which she couldn't tolerate any longer. And in this condition, she came to our hospital. She got just immunotherapy. And you see her years later, 16 years later, and 3 children. And now the most uplifting picture which I can show you. She and her husband became European rock and roll champion. This is her up in the air. If she can fly, we can fly. Maybe not that high. So I would like to explain to you now the principle, the concept on which Dr. Issels' treatment is based. This diagram shows the development of the disease. T stands for tumor, C for causes. When the tumor manifests, then conventional treatment comes into action to remove the tumor if possible and get rid of the symptoms which are due to the tumor. Very often a very tiny little tumor was completely removed. Margins were clear, patients got chemo and radiation in order to be on the safe side. And 6 months later, there's a new tumor. Why? With the removal of the tumor, however refined the conventional treatments may be, they cannot and they are not supposed to take care of the causes which have led to a condition, to an impairment of the immune functions, which then have allowed a tumor to grow. So my husband was very much interested, as scientists knew that cancer cells develop in every one of us, in everybody, in every vertebrate organism. As long as the immune system is intact, cancer cells can be detected by the body, neutralized and eliminated. But as soon as the immune functions are not intact anymore, then tumors may settle down at the site of least resistance. So what is the immune system? Now first, before I show you his diagram about the immune system, I will quickly explain to you. There are causes, prenatal, before birth, and after birth. Before birth, that's the constitution and disposition we inherit. Then allergies, toxicosis, due to the diseases our ancestors have gone through. Some of you in this audience may have heard about tuberculosis miasma. about syphilis miasma. These are the diseases our ancestors have gone through, and tuberculosis, we are exposed to it in childhood, and we develop our resistance, our immune system. But the toxins may still have sensitized the body cells. So here, then come the postnatal causal factors. Nutrition is a very, very important part, as we know, and which is very understandable to every one of us. The intestinal flora, very important. The foci of infection. This is one part of my husband's treatment he was most for which he was criticized the most, because he said, now I have heard it all, teeth and tumor, so this man is really crazy. And then we know about the toxins we ingest, unfortunately, the pesticides, and we inhale. And psychic stress, emotional stress plays an important role. And these causes may, via mutagenic, toxic, sensitizing, and neural effects, cause damage to organs and organ cells. To cells and organ systems, for example, to the liver, which is so important for detoxification, for the heart, our nervous system, and to the detoxification, to the canalization, the detoxification mechanisms. You know, as soon as we cannot eliminate our toxins anymore, then dis-ease starts. We know that what we eat and drink and breathe and think can make us healthy or sick, but even what we assimilate and eliminate, if we are not able to eliminate the toxins which are natural and due to metabolism, if we have toxic intermediate metabolites, which the body cannot, when the body cannot go through the whole cycle, as Dr. Crystal explained today, then there are toxins, sometimes high molecular toxins, which the body just cannot eliminate and stores in the connective tissue in order to protect the vital organs. And the more the connective tissue is burdened with toxins and waste products, the more normal regulations of the endocrine system, of everything, are blocked. I explain to you with the other next following slides. So when we have a bad elimination of toxins, then a complex metabolic disturbance may arise, which is common to all chronic degenerative diseases. And then and a weakened resistance, the terrain. If the terrain is not in order, then our defense functions and repair functions don't work properly. Now it will depend. When we have reached this stage, we may either develop arthritis or another immune disorder or a chronic degenerative disease, or we may develop cancer if we have a cancer gene, for example, which had been found with breast cancer. Therefore, the treatment Dr. Issels applied to his patients was not just the accumulation or addition of some substances which in some studies have proven some effect with some cancers. It was a logistic program which followed the pathogenic path. He started with the causes. He even started with prenatal causes. That's the reason why he gave the Spengler-Sahns, polysahns, which you who have visited the Enderlein conferences are very well acquainted with. And that's why he tries to correct the foci, to eliminate foci, to correct the nutrition, the diet, and also substitute and help the body organs which are already damaged by all these causes in the course of time, over a long time, to help them regenerate. We gave RNA and DNA substances. Now I would like to explain to you about the immune system. We all know nowadays the immune system know much about T cells, B cells, killer cells, macrophages. But this is only part of the immune system. This is only the cellular level of the immune system. The immune system, which tries to maintain the body's integrity, is a very complex mechanism of successive defense zones which are interrelated. We know that the microflora on our mucous membranes, in our mouth, in our colon, is very important for basic immunity. And we know that the skin has very important functions as in defense, excretion, and absorption. Through the skin, we excrete toxins, and we also absorb nutrients or medications. The lymphoreticular zone, which is very important in the cellular mediated immunity, we are all familiar with this, but there is another zone, the fourth zone, the pluripotent mesenchyme, the reticular histiocytory zone, which accounts for half of our body weight. And it is of great importance for all defensive processes, for the stem cell function, for the transit function, which intervenes between all tissues, the storage function, because it does not only store, as I said before, nutrients, also the wastes and the toxins. And I would like to show you now with the next slide. We try to find out about the internal environments, internal terrain, more than the conventional laboratory tests can tell us. They can only tell us how many red blood cells we have, how many white blood cells, but nothing about their quality. So since 1950, Dr. Issels monitored his treatment, in addition to all the conventional possibilities, through the dark field microscope. He looked at the blood. These are red blood cells of a healthy person. This was vital blood. This is what the blood looks like of most of our cancer patients. Lots of fibrin. The red blood cells, the shape is not good anymore. They stick together in rouleau form. And then we try during treatment to convert it back to the healthy stage. And this is the same blood of a healthy person under the gram stain. It's gram stained, a special method which we developed in our hospital, according to von Bremer. And here you see cancer patients. That's what you cannot see without the stain. Here you see DNA of microorganisms in the red blood cell. This can happen, we have seen this with patients who just had a focal toxicosis, who just had devitalized teeth and cavitations and tonsils, infected tonsils. But now you will see something which was typical for cancer patients. We have found this in more than 90% of our cancer patients. These sticking together like in a rod form. Von Bremer called this a siphonospora. He called this the cancer microbe, and there are many scientists who go that far to call these microorganisms cancer microbes. But my husband, Dr. Issels, said they may be contributory factors. He did not go so far as to call them the cause of cancer.
Short comment.
Yeah.
The Siphonospora
Yes.
is today recognized as the propionic bacteria that we talked about at lunchtime. That's a reclassification of what Bremer called Siphonospora, cancer microbes. They're now the propionic bacteria. Mutated strains.
There are many scientists who have found in the past 200 years microorganisms in the blood, microorganisms which live in symbiosis with us as long as our internal terrain is in balance. The acid-base balance if the homeostasis works properly. But we have, as Enderlein has shown, there may be primitive structures which undergo a cyclogenetic evolution. When the terrain deteriorates, then these microorganisms may develop from primitive structures into bacterial and even fungi forms. But these can also be reversed. I wanted to show you, this was when patients get chemotherapy or a vaccine, then you see the plasma. I mean, the red blood cells are not healthy either, but the plasma is completely filled with particles from tumor lysis. And if this is homogeneous like this, then the patient does not develop fever. If it is high molecular and the patient cannot eliminate it, then the body produces fever in order to degrade these particles, to make them smaller. That is how nature helps itself. When we are flooded with toxins, which are too high molecular and the body cannot get rid of, then the body produces fever if we allow it. Mostly, unfortunately, our doctors don't allow this anymore. And then the toxins remain in the body. So this patient may, when you see such a picture in the dark field, then the patient develops high fever in order to get these particles smaller and be able to eliminate them. This was very interesting. This was a sarcoma patient. They had a tumor in the brain. And she was treated already for 3 weeks. But with brain tumors, you have to be very careful, because if they swell during treatment, this is of vital importance to pay attention to. So she got radiation. And you see 6 hours after the first radiation therapy of 250 rats, you see how the microorganisms thrive again in the red blood cells, because it is a lowering of the immune functions. And here you see a picture 64 hours after the 5th radiation therapy. You see the rod forms of the Siphonospora, and the red blood cells have lost their shape. Here this is 4 hours after the 10th X-ray radiation therapy. And I show you the next one just. And this was how many months? 3 months after the last treatment. How long it took for the blood to recover again. And here you see vital blood. This is healthy blood, very homogeneous. And this is the blood of a cancer patient. Not homogeneous anymore. And this is something which you are familiar now with due to Dr. Meinig's instructions and very, very informative lecture. This is what a German doctor, Meyer, he made a cast of what the roots of teeth. And this shows that when the dentist fills the vertical main trunk, all these tiny little branches and twigs where the bacteria decompose, he cannot reach them, they cannot be sterilized. But this is, I think, Dr. Boyd Haley will be able to tell you much, much more about this subject than I am ever able to tell you. But it was interesting that already in the early 50s, there were working groups in Germany and Austria not knowing about Dr. Price's work. I mean, my husband was familiar with Dr. Price's and Dr. Pottinger's work in the field of nutrition, but he didn't know about the work of root canals, and he was excited when he came to the States several years ago and found Dr. Meinig's book, and he bought Dr. Price's books, of course, too. So independent, researchers in different continents came to the same findings and conclusions, which is very interesting. And I would like to show you now something. Yeah, that's mostly what cancer patients looked like when they came to our hospital. And here, this was interesting. 2 root canal filled teeth here and there. We measured the infrared. This is a granuloma. These teeth had a good local resistance. I mean, the surroundings, the body had a good resistance in this area. because it could protect the organism from the pus, which was, and the toxins formed in these roots by forming a granuloma. And the infrared emission, which we measured, was not very high. But here, there were teeth which a dentist of our days would say they are fine. You need not pull them because there is no granuloma. But as Dr. Meining said, the resistance, the local resistance was not that great. So the toxins may go directly into the bloodstream. And here we had in the early 50s, there was Mr. Ray, Schwamm and Ray came to our hospital, and my husband and Dr. Issels and his team and Dr. Ray developed the topogram, or what was it called? Toposcope, yeah, to measure the infrared emission above teeth and above tonsils and above the tumors, which I will show you now. So we could establish a correlation between the foci on teeth and tonsils and the tumor. Nowadays you will probably have and hopefully develop more convenient instruments to measure the infrared emission. Here you see the infrared emission measured above the teeth of a metastasizing uterus carcinoma, of a stomach carcinoma, and a Hodgkin. So you see how high the infrared emission was above these teeth. And here we have an example of a carcinoma of the stomach. You see the infrared emission above. Can you see it properly? Above the root canal teeth and above the tumor. After elimination of the root canals, the infrared emission reduced also above the tumor. And after neural therapy, the infrared emission completely disappeared above the teeth, or where the teeth were, and above the tumor. And here are some such examples. This is the same with the bronchus carcinoma. We did extensive studies in this field just to establish the correlation between, because Dr. Issels found out that during treatment, after the elimination of focal infection, he started with the teeth. So every patient who came to the hospital had, of course, in addition to the physical and all the examinations by the relevant specialists, their teeth evaluated. So they were astonished the first time a doctor looked, not a dentist, a doctor looked into their mouth. And we had some panorama X-ray and then tried. We had some other methods, which we called the electrofocus test, to find out above their, how should I say, in their face when there were red spots which showed which were the most aggressive foci. And here you see another example of the infrared emission after another. And here are the consequences of head foci. They are, the toxins are filtered in the tonsils, which unfortunately renders the tonsils, which are mostly infected already, even more sick. And then can you see causing secondary damage to the body cells. I will explain to you, I think I should do it here with this slide. You saw with the first slide with the hypothesis that foci may exert effects or damage via mutagenic, toxic, sensitizing and neural ways. The neural ways are easy to deal with because we know that neural therapy, Dr. Ferdinand Hunecke, Dr. Klinhardt can tell you much more about it. Dr. Hunecke in Germany about 60 years ago found out that by injecting an analgesic into near a primary focus could eliminate the symptoms of a distant disease which was due to this focus. And this could happen within seconds, and then therefore it was called the second phenomenon. And Joseph was also trained by Huneke. He was still a young doctor at the university when he met Huneke and was very interested in what he was doing. And then he became so good that Huneke asked him to replace him for 2 months while he wrote his first book. So in our hospital, neural therapy was always a given. And Dr. Meining spoke about the toxic effects of root canals, and also there are tonsils also which are toxic effects. But there are neural effects and there are sensitizing effects, because the theoethers which form in root canal teeth, the dimethyl sulfide, is a carcinogen because it transforms the aerobic. We know that our normal cells oxidize, and cancer cells have the anaerobic metabolism. Due to theoethers, the aerobic metabolism may be disturbed, and the cells, in order to survive, then become anaerobic. They switch to the anaerobic metabolism. And these cells are damaged. The body's mitochondria, the breathing enzymes, are damaged by theoethers. And this is very, very important. So there is not only the neural way, which reports to the brain that there is a focus, and therefore Dr. Issels, after taking care of the neural symptoms, always insisted that the toxins, that the focus as such was removed too. And there is also the sensitizing way, because theoethers are half antigens. And these cells then denaturize normal proteins, which the body then recognizes as non-self and forms antibodies against these, which were used to be normal body proteins. And this may now set forth the autoaggression, the beginning of the autoimmune diseases, which are so common nowadays and which have always existed. Here we made a study of 466 cancer patients who had their tonsils removed. All the tonsils which were removed in our hospital were examined histologically and bacteriologically. And we found out of the 466 tonsils, 100% were macroscopically damaged. And we even found 5 cancers behind the tonsils. Very often the ENT doctor said, "Doctor, I don't understand you. Why do I have to take these tonsils out? Look, they are so small, they look completely normal." But due to his experience, Dr. Issels knew that these tonsils looked normal, but they were not. They couldn't be luxated out of their bed anymore. They were atrophic. But the protein was degenerated. And I think Dr. Klinhard will talk to you about this tomorrow. And then we also did in our laboratory, just to give you an overview what was done as comprehensive treatment. We had a microbiological laboratory where Professor Gerlach from Vienna, the authority on mycoplasma, worked and developed a mycoplasma vaccine. We had always given since the early 50s an autologous vaccine made from the patient's own blood. But this vaccine was made of mycoplasma, which were found in the tumor cells. And we had big laboratories with animal testing laboratories. 209 mice were inoculated with the mycoplasma of various cancers. And this was, I think, an adenocarcinoma. then the 600 control animals of the same breed were not injected, and 90%, not, how much does it say? I think 1% developed cancers of the control animals, and over 90% of the injected or inoculated animals developed cancer. So this cannot have been a coincidence. So microorganisms which were one out of tumor cells of cancer patients in our hospital, inoculated into mice, induced in over 90% tumors in these mice, and 3 times the same number of animals of the same breed were not inoculated, and they did not develop cancer in over 90%. And what was very interesting, it speaks for the importance of the terrain, not for the importance of the microorganism, but the terrain, is the fact that the mycoplasma, one, for example, out of a sigma carcinoma, did not only cause the formation in the mice of a sigma carcinoma, but of adenocarcinomas, sarcomas, lymphomas, a variety of other cancers. And here you see the same. This was an adenocarcinoma, developed sarcomas, all sorts of cancers. So it is the terrain which is important. Just one part of our treatment was the injection of bacterial vaccine to help the body produce fever, because this is a great immune boost, and also cleansing. We have looked into the dark field after the fever treatment. The plasma, which has fibrin the day before, after fever treatment, looks almost clear. And leukocytes, which were 4,000, 6,000, or 10,000, could within 24 hours be increased to 40,000, showing a great immune boost, which can only be achieved with fever, with active fever, not with hypothermia, passive fever. And we also tested the acid-base balance within the patient, because we knew when the blood pH was too alkaline, then these microorganisms thrived. And this is a normal person having 2 ammonia floods. And this is what a cancer patient looks like. And the wider this band, the worse the prognosis of the patient. It shows that he cannot regulate properly. We checked the electrolytes, and we saw with all the patients, this was a study of 1,819, the potassium was too low. And this is again potassium too low. That's why we add. And this is also like fork medicine. My husband always looked at the tongues. This was a patient with a glass tongue, what he called a glass tongue. Couldn't eliminate toxins via the intestines. Everything blocked. And after tonsillectomy, that's what a tongue looks like. It's no chocolate. It's a toxin. Just to show you also that we combined chemotherapy if it was necessary. And if we could combine chemotherapy with fever therapy, then half of the usual doses of chemotherapy could be given with the same curative effect, and of course with less toxic side effects. Here we have combined this with glucose. Yeah, maybe it's too much. I don't know how much time I have left. I think we skip this. We measured whether the patient, whether he was vagotonic, sympathicotonic, or parasympathicotonic, because this gave a great indication on his reaction. This is normal. This is very much blocked. This shows this patient cannot react. And we, in addition to the fever chart, we always pulse and temperature, and you will see a fever chart at the next slide. We always measured the patient's reactivity, measuring the skin resistance and capacity according to the principle of the Wheatstones Bridge. Here you see, this was a very interesting case. This was a young boy with a brain tumor. He was so aggressive that in the hospital they had tied his hands to the bed, and he was attacking the nurses. He had many seizures, every day, several seizures, every day. You couldn't even mark them down. This is the fever chart Dr. Issels had developed in his hospital, which was in each patient's bed, room, and every patient was explained exactly what the treatment was about, why he got what. And he showed the patient, now you see we are here. This was for 4 weeks, a fever chart for 4 weeks. Here we are today. Here we have to be in 3 weeks. Now we both work together. It's a two-way partnership, which is very, very important. And also the mind plays a very important role. He asked the patients to forgive their enemies, forgive whoever has done something bad to them, forgive themselves, come to peace, to be able to reach peace of mind, you know, the first step towards healing. So, and we have also seen, which is interesting, which may interest Dr. Crystal, we have measured the blood pH, how should I say, the mind directed the blood pH. We had the measurement in a patient's room, in several patients' rooms. My husband entered the room, looked at the patient as if everything was going well. We saw the blood pH went exactly, the needle went exactly the way it was supposed to. And then in the other room, but of course then the pendulum goes back and normalizes. And in the other room, my husband entered, looked at the patient as if something was wrong. Immediately, the blood pH, the measure, the needle went to the wrong side where it's not supposed to go. So if we are under constant stress, it is very, very bad for us. Permanent stress or a great grief. And we have also induced laughter sessions for the patients. Every afternoon, we encourage the patients to look at Charlie Chaplin or Buster Keaton or whatever, just to make them laugh and forget about their problems. But this fever chart just shows you it was for 4 weeks. It has all, whatever the patient has gotten, all the reactions, stool, bowel movements were very, very important, how much intake, fluid, what the patient got as medication, how he reacted to the medication. This all was in the fever chart. And on the back, there was a folder, and there were all the laboratory and other findings. And this patient had, for 3 weeks, treatment did not work because he was blocked. You see here, we measured his biotonometer, his vagatonic or his reaction, and saw he was very much blocked. So my husband talked to the patients. He didn't see any other chance than to make a fever, to induce fever by choletoxins. And he talked to the patients that with a brain tumor, he may die. But he was terminal anyway. The parents knew that's what the oncologist had told them in the hospital where they came from. They had no chance. So the patients agreed to do the fever shot. The patient tolerated it well. And you see, here's the fever. You see on the chart, the temperature. And you see here, normalized. The biotonometer reading normalized. So that fever could break through a blockade. And the patient had, you see in the next days, no seizure anymore. There came off and on a seizure once a week maybe, and then after 3 months he was discharged home. And we saw him 10 years ago. This was in 73. We were in Germany in 85. We saw him, he was in a very good condition. He had become a very good student and would not have been able to survive without this drastic measure. And this, I just want to explain to you that a treatment, a comprehensive treatment, taking away causal factors of the very, very toxic dental foci, you will hear about from Dr. Boyd Haley, and the tonsils, which Dr. Klinhard will explain to you, and change the diet and many other measures which are necessary according to the individual case, you can achieve even patients who have exhausted all conventional treatments. We have now here assumed 2% spontaneous remission. So these patients who had exhausted all conventional treatments, we had 17% of the cure rate of patients with a variety of cancers, and patients who lived up to 40 and 45 years. And we can also, with this treatment, reduce the incidence of relapse. We know that world statistics tell us that 50% of the patients after conventional treatment develop a new tumor, get a recurrence. And if you improve the immune and repair functions of the body after conventional treatment and do not wait until a new recurrence forms, then you can increase the cure rate up to 87% with the treatment modalities that are available already today. And I would also like to say that many patients who came to our hospital with other problems, such as arthritis, chronic eczema, asthma, heart conditions, due to this very causal treatment, improved, and many of them get rid completely of their chronic degenerative conditions. And with this, I would like to thank you very much for your patience, and I hope it gives some stimulus, and every doctor then continues to treat according to his own experience and intuition and constitution. Thank you very much. Thank you.
Do we have any questions for you?
Yeah.
Are there any questions before we break? Can we have the lights, please, Colonel?
Thomas Brown talks about ways of reducing fever using Sanum remedies. Specifically, I think he talks about Botulinum blue.
About which?
The Botulinum blue.
Yes, yes.
I'm curious how you feel about such induction.
Very good. Sano preparations are very good. We have used Sano preparations also.
Would it be enough?
It depends on the individual case. But they are very, very good.
Could you combine it with hydro?
Combine it with
Or
what?
Traditional other forms of fever therapy? Could you combine a bacterial remedy with another form of fever therapy? I guess what I'm saying is...
What fever therapy do you mean?
Well, Coley's is so...
So aggressive. Yeah.
And so there are some other ways, electrically stimulating fever, and I'm just curious.
Yeah, if there are ways, then it is of course very good. If they can be less aggressive. But sometimes it's just the aggressive way which breaks through a blockade, sometimes. I mean, we have given Coley's, I'm sorry, I go too close. We have given Coley's since mid-50s and never seen any toxic side effects or any adverse side effects. Maybe because we didn't give Coley's to any patients who had still focal infections, teeth and tonsils, you know. We have only given fever treatment to patients who were completely clean in this respect.
So now a question. Considering that the dental foci were removed and
Yes.
the tonsils were removed,
Yes.
what do you imagine the blockade to have been with the patient for whom the Coley's worked? Where do you imagine that blockade was in the system?
The blockade in the central nervous system, probably. The encephalon, hippocampus, hypothalamus. It's very hard to say. You know, it is very difficult. As Dr. Crystal said today, everybody needs another diet. You cannot say this is a diet for all, but we know that the cancer tissue is the most acid tissue, and that the intracellular space is too acid. And then the blood pH gets too alkaline. And when the blood pH gets too alkaline, then these microorganisms thrive. But there has to be this balance between acid and base. And we know that with our food, we know that the body produces acids due to metabolism. The body cannot produce alkaline substances, so we have to ingest the alkaline substances to neutralize the acids, which we take with our food or which we form due to our metabolism. And we know when we get older, and especially when we are sick, our digestive enzymes don't flow as they did before. And then sometimes the metabolic cycle stops at a certain phase when toxic intermediate metabolites, which would normally have been neutralized until the end, but they could not because the metabolism didn't function properly. And then they stay in the body and they go into the mesenchyme. And the children, many children, unfortunately, are not allowed to produce fever during their childhood. And then we have all these toxins. Unfortunately, the fever, with which they would be able to eliminate the toxins, they store the toxins in the mesenchyme. Excuse me. Yeah.
Do you know if Dr. Issels used large doses of enzyme proteases?
Yeah, enzymes, yes, yes.
To break up that
Yes, 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 yes. We used digestive enzymes, of course, and we also used proteolytic enzymes, the Wob enzymes, Wobemucos. This was a very important part of our treatment.
But the fever therapy is more effective with the enzymes breaking up that.
The enzymes would take longer, and sometimes the patient doesn't have that much time. So we had, excuse me? Yeah, please.
Is it actually fever therapy, or is there something else going on? It sounds like fever therapy might be a misnomer, because hyperthermia, you mentioned, does not work, and therefore, presumably, there is something else happening with the immune system,
Yes.
which happens to cause
yeah.
the body to mount
Yeah.
a fever, but that's just a marker
Yeah,
for the
yeah, yeah.
underlying process.
We know that hyperpyrexia, what we call this fever-producing treatment, induces interferon. So there are many, how should I say, processes which we cannot yet explain. And you all know about mixed bacterial toxins, the Coley toxins. Dr. Coley in 1896 came across this just by coincidence. It seemed to him like an accident. A patient who was supposed to, with a sarcoma, who was supposed to die, developed a high fever due to an erysipelas infection, and the tumor melted away. And then this happened. It was no coincidence. And then that's how they started to treat. And they treated with Coley toxins in Sloan Kettering Institute until the 1930s, until Dr. Fishbein and other professionals then prohibited this. But I would like to say that for many patients, the softer way may be better. We always tried to differentiate. We always started with the lowest possible doses to give fever, to find out, to find out how the patient reacts. And if there are other gentler ways which have the same effect, that's the better. But very important, very good are the underlying products, and we have used them in all these years.
Okay, we're going to take a break now. Thank you very much.
Thank you.
Very good. Very
Welcome.
interesting.
Thank you.
How can I, what's the name of the gram stain that you use?
Beg your pardon?
The gram stain that you use?
Yeah.
How can I get that?
A good question. We still have the technician who worked.
processing capabilities with a one-time opportunity to limit the admissibility of those earlier statements in future lawsuits, although this does not apply to previous contract content that had been drawn. There are three elements to the Act with which you'll want to become familiar and know how to deal with. One, year 2000 statements. These are general statements made in the course of business, verbal and written. But then there is the year 2000 readiness disclosures. These are more formal documents that declare in a formal sense your firm's readiness. And then the retroactive designation is the process by which you declare statements made previous to October 18th, 1998 with regard to disclosure activities. The Act is complicated, in some cases open to interpretation. The purpose of the policyholder alert that you'll be receiving next week is to help you in the most general terms to determine how you can best take advantage of the new law's provisions to minimize your potential Y2K liabilities and preserve your Y2K rights. You should consult with counsel to explore the impact of this act on your individual firm as well as your relationships with your trading partners. And now to the first feature of the morning. ISO certification for an DPRCG member. 1 year ago,